Hi, Michael. How are you today? Glad to be connected and welcome to Healthtech with Purpose podcast.
Ayush, thank you for having me.
Yes, same here. Same here. Let's start with somewhat of understanding of your role and your day-to-day things that you work in, and especially related to healthcare. What things are you guys up to?
Yeah, so I have the honor and privilege to manage the healthcare vertical for VMware here in North America, and so I've been here 6 years. I actually came to help build out this vertical and figure out how the technology portfolio that we bring to market addresses the needs of healthcare, and we believe that the technology that we bring to market is very much aligned with the needs of healthcare in terms of driving or bending the cost curve, providing better outcomes, better security, and more health equity across the ecosystem.
Okay, great. Tell us a bit more about VMware's technology, especially relevant to the digital transformation of healthcare industry, and from what you've worked on and what you've seen, what impact it has had on the patient outcome.
Yeah, so there we have a build product. We in care all the way from the edge to the cloud is done. So our primary focus is on how we can enable our clients and customers to utilize multi-cloud strategies to help drive better outcomes within their organizations. And as most health systems today are under tremendous cost pressure. So, to the extent that they can take some of that cost out of the environment or be more efficient about how they provide patient care, is really where we focus our solution sets and how we address the needs of customers. So everything from how applications, both clinical and non-clinical, are rendered within the organization to how does a customer utilize the multi-cloud strategy, both private and public cloud, and also take advantage of things like back-end microservices from the hyperscalers around machine learning and artificial intelligence and things like that are going to be critical, I think, in moving the needle within healthcare.
Right. In fact, I see, of course, the big talk around the multi-cloud strategy in the healthcare environment. But since you have, watched this whole system so closely, would you like to give a walkthrough into a practical story that you have seen or some implementation and how it helped? Just elaborate, please.
I mean, I believe, Ayush, that a lot of this was accelerated during the pandemic, right? And so when we look at how healthcare organizations had to pivot in delivering care, we were on the forefront of helping those organizations do that. So some great examples of a lot of those organizations moved their entire or the majority of their workforce from inside the four walls of the hospital to working remotely. And so our technology enabled them to still be able to be productive and be remote at the same time. Some of those technologies today are being used in ways that address a number of issues. And so, for example, we look at teleradiology as an example where we can address multiple issues in healthcare. So, for example, a lot of radiologists needed, bandwidth, high bandwidth, and secure access to be able to diagnose and read images. So we provide that capability in a secure, compliant way, and it addresses multiple things. One is, it also allows organizations that might not have access to some of those specialties within their geographic footprint to get those specialties and support in a remote or telehealth environment as well. And so we think that is a huge outcome in terms of both access for underserved communities or rural communities, as well as a cost reduction, so that organizations can get access to specialties that they might not normally have access to.
So, Michael, is this limited to some of the largest institutions and hospitals, or is this something that you see more and more usage in the mid-tier or
Yeah.
smaller organizations as well?
Yeah, one of my passions is around health equity in general. And so, I'm also a board member and a founder of an organization called Black Directors Health Equity Agenda, or BDHEA. And, I believe that technology is an enabler and helps close the chasm between access of have and have nots. And so, my firm belief is that, technology might not necessarily be the only path to a solution, but it is absolutely an enabler in terms of how we get there. And so, studies have been done, and I think, again, the pandemic highlighted some of these disparities within the organization, and there are studies that back up that, underserved or poorer communities have poorer outcomes in terms of healthcare. As you're aware, we spend a significant portion of our GDP on healthcare in the United States and don't necessarily drive better outcomes than other developed countries in the world. And so I believe that the path to creating or closing that gap really is to focus on those communities where we have the biggest issues in terms of delivering quality care.
Makes sense. Makes a lot of sense. So, Michael, elaborate more on the role of, since you touched upon cloud computing, evolving with the healthcare industry over the next 5 years. So, what are the things that we could look forward to in the future, and how is VMware positioning itself around those things?
Yeah, so again, there are a few things. We talked about bending the cost curve, and we talk about things such as sustainability. VMware was in the sustainability game before it became a thing. Our innovation and in our 25-year history, we were focused on actually how do you, create a more sustainable environment and help organizations reduce their carbon footprint without that necessarily being a priority. So if you look at our virtualization strategy or technology across compute, storage, and network have absolutely impacted, how organizations, become more sustainable as well. And so we'll continue that as we go forward. Again, the multi-cloud environment also supports that from a sustainability perspective. And, it allows organizations to look at the workloads and applications that they have and make a determination as to where is the best place for those to run. As I mentioned before, how can they get access to backend services from a hyperscaler perspective, and also, have an ability to manage and monitor and automate some of those processes so that they're doing it in the most efficient way. And that's where VMware comes in, and we really play a huge role in terms of helping organizations address that. As I said before, I came to VMware to help build out a vertical. So it's very important that we do the translation of technology and solution sets to outcomes. And so we work very closely with both our partners and our clients to make sure that the technology is focused on the things that are going to help them provide better outcomes in their organization. And as I said before, I come back to my BDHEA roots. It's really important that, if we're going to change some of the dynamics around bending the cost curve, that we're addressing the most vulnerable communities. And how do we, make sure that we are providing services in that regard as well. And so, that is, how I kind of blend my passions around, technology and equity.
Great. Okay. So, Michael, so a bit of light on what you were doing with VMware and what led you to choosing VMware as your destination further.
Yeah, that's a great question, and thank you for that. So I've been in the industry for 40 plus years. I've been focused on healthcare exclusively for the last decade and a half. I spent 15 years with Microsoft and actually managed Microsoft's business, public sector business in the Middle East and Africa. And so two of the prominent segments in that business were healthcare and education. And I just got the bug around, driving outcomes and improving. And if you know that area, it's one of the most diverse areas in the world in terms of the dichotomy of, economic status, geopolitical, you name it. It's just so many dimensions of diversity there. that it really, helped me build this passion for improving healthcare globally. And so I spent the last 5 years that I was at Microsoft running the health and life sciences practice there. And I retired from Microsoft in 2016 and was recruited to VMware by some friends who, were familiar with my work. I still stayed in the healthcare space. I was investing in early stage healthcare companies, which I still do today. But VMware said, hey, we want to be a thought leader and have impact in this vertical. So I was recruited 6 years ago to help build out the vertical. We now have, over 1,000 people in VMware that are focused primarily on healthcare and help driving better outcomes there.
Great, great. Okay, nice. So where does it go from here? So, Michael, like, what are the new challenges and new things that you are seeing?
I think I think the sky is the limit, Ayush, and there are some things that we're really focused on. So I think data is really important. As you know, the proliferation of data in healthcare has been exponential over the last 5 or 10 years. Since in the U.S. we've had the Affordable Care Act, and we digitize most of our medical records. And so interoperability, I think, again, will be a key driver. We talked about AI and ML in terms of precision medicine, providing data at the point of care, meeting patients where they are. And again, it goes back to that health equity question around, how do we address the most vulnerable populations that we believe will move the dial. So I'm very bullish and positive on the outlook. I think in the last 3 to 4 years, post-pandemic, we've made more strides than probably the prior decade in healthcare in the U.S. And so, I think there's a huge opportunity both for technology and addressing some of the policy issues that exist here to again,
Would you like to elaborate a bit more about the AI, ML data? Because I mean, again, the world we are in, they require more attention, and definitely the new huge opportunities are coming out of it. So, if you'd like to go deeper with this.
So again, I think that there are. We just had a conference that we call Radio, and it's where we collect, a bunch of innovation and ideas from our teams and our engineers in terms of what the future looks like. And it was almost exclusively dedicated to AI and ML, as with the advent of things like ChatGPT and those type of technologies. It's going to be important that we are able to bring together both structured and unstructured data, and that we learn from that data. Again, going back to the health equity question, we believe it's important that data is inclusive, right? So, when you're talking about, actually machine learning and learning, if the data is not representative or equitable, then the outcomes that you drive are going to be biased as well. And so, BDHEA and other organizations are focused on, how do we make sure that data is more equitable, more inclusive. When you look at things like clinical trials, when you look at, development of protocols, et cetera, it's going to be really important that we broaden the aperture on the data that we get. And the data is there for sure. It's just a matter of making sure that, to my earlier point around interoperability, that we're getting access to both the structured and non-structured data there.
Okay, makes a lot of sense. So, what is the biggest challenge, Michael, you see for hospitals, who are implementing this whole multi-cloud strategy, the VMware solutions? So, what is those top challenges that you see, and then if you can elaborate how you can solve them?
Yeah, so there are a couple of things that come to mind. One is that at the heart of delivering care are really the applications and how those applications are organized, where they reside. How do you get data in and out of those applications? And our strategy around multi-cloud is we believe that a lot of organizations have gone forward with a cloud strategy, but it's been somewhat chaotic in terms of how they bring that together. And what we advocate for is a process that calls for cloud smart. And so we believe that you have to go through that rationalization of understanding your portfolio of applications. Some will be, need to be modernized. And so through a development process, which we have tools to support and drive as well, you develop new modern applications. In some cases, it's a matter of taking those applications that you already know and manage today and give them the ability to be mobile and can actually go into, multiple environments. So for today, for example, you wanted to run a particular application in Microsoft Azure because of some of the backend microservices that you get access to. You can do that today. But if your strategy changes in the future and there's more benefit to run that in Amazon or Google, you have the ability to be able to port those applications where it makes the best sense to run those. In addition to that, the ability to be able to manage, automate, and run those applications and have visibility into both the economics and the operational efficiency of those applications in your environment. And so we take a pretty holistic approach to being able to build where you need to build, manage and run where you need to manage, and then also giving you the flexibility to drive out cost and be cost efficient in how you deploy your strategy.
Okay, fair enough. So you give them that flexibility from the options to choose from.
Yeah, we like to say that we're kind of the Switzerland of multi-cloud, because again, you're building on the virtualization level of abstraction that we've been doing for 25 years now.
Okay, thanks. So talking about the health equity piece, Michael, and this has been a theme, that has loomed long enough because, every time anybody looking to do good things, they are definitely inclining upon the pillar of health equity or how you make it available for everyone and so on. So, your own version of it, like how do you see it will eventually get solved if it would be, and then what would be, the reasons that it would get solved? Because someday we have to solve it. It cannot be a perennial problem all the time for all the generations.
Yeah, it's a very complicated issue, and I believe that we have to take a multi-pronged strategy to addressing it. Part of it is access, to those communities. As I said earlier, a lot of communities just do not have the bandwidth or access to, some of the technology and some of the specialties that are required. Some of it is around education, but I believe the health systems play a critical role. And my role at BDHEA as a founder and a board member is to make sure that we are creating executable strategies at the board level to address some of these. So to do that, we've come up with 3 defined strategies. One is a board director's playbook. So how do you talk about and keep equity top of mind in the boardroom as you're making decisions around how to execute in the environments you are. We talked about sustainability. So we have an ESG guide for boards as well. And then the new one is, as I mentioned earlier, the part about reducing the carbon footprint. So decarbonization as a strategy for health systems as well. Again, I think all of these things play into, how do we address both the social determinants of health as well as, the technology disparities that exist as well. And so, proud to be a member of this organization that is really looking at exit. There are so many people out there that are focused on this issue, but I think at least here in the U.S., it's important that we have that board level conversation and executable strategies. And we've developed these strategies with, premier thought leaders like Deloitte in terms of how we bring that to market. So a lot of work to do, but I feel optimistic about where we are at the point in time and how technology can play a role in solving that.
So last question, Michael, what keeps you awake at night currently? Challenges or potential solutions that you're working on?
Yeah, so we worry about security. From a VMware perspective, we're one of the premier security providers and have a broad set of portfolios. There's not a C-level executive that I speak with in the healthcare industry that's not top of mind for them. So therefore, it's top of mind for me as well. Again, my passion around equity is another thing. Just to make sure that we're creating these strategies that apply to all people. And if you look at the research, it's important to understand that a lot of the cost drivers around healthcare are because there's inequitable application of both services and solutions, and how we look at the broader health ecosystem. So those are, I think, the two things that I'm most focused on today in my role. I'm very blessed to be able to have an impact in those two areas, and we believe that VMware is a key thought leader in both those areas as well.
Great. Thank you so much, Michael, for all the wisdom that you've shared. And I believe this would be a great view for anyone who wants to solve healthcare, health tech, and especially around the health equity side of things. So thank you so much.
I appreciate the opportunity to chat with you, and again, appreciate your interest in VMware and BDHEA and health equity.